You are going to listen about anemia. Anemia is a condition of lower than normal red blood cell (RBC) count and hemoglobin level. Anemia results in a diminished amount of oxygen delivery to body tissues. There are many different kinds of anemia, but all can be classified as being due to either a decrease in production of RBCs or excessive destruction of RBCs or a loss of RBCs, means bleeding. Other etiological factors, including deficits in iron and nutrients, are hereditary factors and chronic diseases. Complications of severe anemia include congestive heart failure, paresthesias, and confusion, and other problems specific to the type of anemia. Clinical manifestations or signs and symptoms include several factors influence the development of anemia, including its severity, speed of development. The faster the onset, the more severe the symptoms, and duration, that is, its chronicity. The patient's metabolic requirements, coexisting disorders or disabilities, example cardiopulmonary disease, and special complications or features of the condition that produce the anemia. Pronounced symptoms of anemia include the following: dyspnea, chest pain, muscle pain or cramping, and tachycardia, weakness, fatigue, general malaise, pallor of the skin and mucous membranes, sclera, oral mucosa, etc. Jaundice, megaloblastic or hemolytic anemia, smooth red tongue, iron deficiency anemia, beefy red, sore tongue, megaloblastic anemia, angular cheilosis, ulceration of the corner of the mouth, brittle, ridged, concave nails, and pica, unusual craving for starch, dirt, ice in patients with iron deficiency anemia. Now, diagnostic evaluation of anemia are complete hematological studies, that is HGB or hematocrit reticulocyte count and RBC indices, particularly mean corpuscular volume. Iron studies, serum iron level, total iron binding capacity, percentage saturation and ferritin, serum vitamin B12 and folate levels, haptoglobin and erythropoietin levels, bone marrow aspiration and biopsy. Other studies as indicated to determine underlying illness. Now, medical management are correct or control the cause of the anemia or replace lost or destroyed RBCs. Nursing management include assessment, obtain a health history, physical examination and laboratory values. Ask patient about the extent and type of symptoms experienced and the impact of those symptoms on the patient's lifestyle, medication history, alcohol intake, athletic endeavors, etc. Ask patient about any loss of blood, example excessive menses or vaginal bleeding, use of iron supplements during pregnancy. Question family history regarding inherited anemias, perform nutritional assessment, ask about dietary habits resulting in nutritional deficiencies such as iron, vitamin B12 and folic acid. Monitor relevant laboratory test results, note changes. Assess cardiac status for symptoms of increased workload or congestive heart failure, tachycardia, palpitations, dyspnea, dizziness, orthopnea, exertional dyspnea, cardiomegaly, hepatomegaly, peripheral edema. Assess for neurological deficits, presence and extent of peripheral numbness and paresthesias, ataxia and poor coordination, confusion. Assess for gastrointestinal function, nausea, vomiting, diarrhea, melena or dark stools, occult blood, anorexia and glossitis. Major nursing diagnoses: activity intolerance related to weakness, fatigue and general malaise, altered nutrition, less than body requirements related to inadequate intake of essential nutrients, altered tissue perfusion related to inadequate blood volume or hematocrit, non-compliance with prescribed therapy, collaborative problems or potential complications can be congestive heart failure, paresthesias, and confusion. Planning and goals for anemia include the major goals may include tolerance of normal activity, attainment or maintenance of adequate nutrition, compliance with prescribed therapy, and absence of complications. Nursing interventions are managing fatigue, assist the patient to prioritize activities and establish a balance between activity and rest. Encourage the patient with chronic anemia to maintain physical activity and exercise to prevent deconditioning. Use safety precautions to prevent falls from poor coordination, paresthesias, and weakness. Monitoring and managing complications. Decrease activities and stimuli that cause an increase in heart rate and cardiac output. Encourage patient to identify situations that precipitate palpitations and dyspnea. Administer oxygen. Elevate head of bed for dyspnea. Monitor vital signs and observe for indications of fluid retention. Monitor for signs of paresthesia, poor coordination, ataxia, and confusion. Implement safety measures to prevent injury. Maintaining adequate nutrition. Encourage a well-balanced diet, high in protein, high caloric foods, fruits and vegetables. Teach patient to avoid or limit intake of alcohol and spicy, irritating and gas-producing foods. Plan dietary teaching sessions for patient and family. Consider cultural aspects of nutrition. Discuss dietary supplements, example vitamins, iron, folate as prescribed. Maintaining adequate perfusion. Monitor vital signs closely and adjust or withhold medications, antihypertensives as indicated. Administer supplemental oxygen, transfusions, and intravenous fluids as ordered. Monitoring and managing potential complications. Assess the patient with anemia for congestive heart failure. Obtain and record body weights in addition to intake and output. Administer diuretics as ordered. Perform a neurologic assessment. Note paresthesias, signs of spinal cord damage, gait disturbance, problems with balance, mild but gradual confusion, diminished sense of position and vibration. Promoting home and community-based care. Promoting compliance with prescribed therapy. Teach patient and family the purpose of prescribed medication, how and how long to take the medication, and how to manage side effects of therapy. Assist patients in developing ways to incorporate the therapeutic plan into their lifestyle. Inform the patient that abruptly stopping some medications may have serious consequences. Assist patient with obtaining needed insurance coverage or exploring alternatives for obtaining expensive medications if needed. Gerontological considerations are: anemia is the most common hematologic condition that affects elderly people. This population typically has a decreased ability of the bone marrow to respond to the body's need for blood cells. The elderly person may be unable to increase blood cell production adequately in cases of increased need, seriously affecting cardiopulmonary function. Identify and treat the cause of anemia rather than considering it a consequence of aging. Elderly people with a concurrent cardiac or pulmonary problem may be unable to tolerate the anemia. A prompt, thorough evaluation of the anemia is warranted. Evaluation. Expected outcomes: tolerates activity at level that is safe and acceptable, attains and maintains adequate nutrition, maintains adequate perfusion, experiences no or minimal complications. This was an educational audio about anemia. I hope you will have better understanding about anemia after listening this audio. Thank you.